of government through a party organization. There was no presidential vertical coordination because Bolsonaro was never interested in implementing stringent policy, not even at the national level, much less at the subnational level. The case of Brazil is a case of no coordination at all. And that might explain why we are where we are now in Brazil. In the United States and in Mexico, we have a mixed scenario. In the United States, there was some coordination, both through parties and through the president. And also we see that several governors coordinated horizontally. They were able to form gubernatorial alliances that decreased that level of variation across states. And in Mexico, a similar story. We do not find a lot of evidence to show that there was vertical coordination, but we do find evidence of horizontal coordination. Again, governors coming together to coordinate policies at the subnational level. I will skip the quantitative results and I'll show you some of the findings that we have. So this is interesting. We see that there was more policy stringency where democratic governors were ruling. This is not new to anybody, but where the states where the voters were blue as well, were Democrats. But yet, this is very interesting. We also see that there were more stringent policies in states ruled by Republican governors, but where the electorate was blue, meaning that the voters. Yeah. So that would be the case of Massachusetts. That would be the case of Maryland, and of course, in states where there were Republican governors, either in cases where there was a Democratic governor, but the voters had voted for Trump, we see lower levels of stringency. In terms of horizontal coordination in the US, we find that in cases where governors were able to come together in these coalitions, such as the Northeastern Governor Coalition, they were able to coordinate to keep a certain level of policy coordination among those states. In cases where we do not have those coalitions of governors, we see that it was much likely to have lower levels of policy stringency in those areas, meaning that there were more permissive policies for people to move around, to not wear masks, to attend schools, etc. In the case of Mexico, as I said before, we also find evidence of horizontal coordination, but here it's interesting in the sense that we have governors who were able to get together to coordinate, but they coordinated to have less stringent policies. These governors wanted to have to open up their economies, and we see that when they coordinated that, they were able to reduce the level of stringency in the states that pertain to that coalition. In Brazil, as I said before, we find evidence that there is no coordination whatsoever, no evidence of presidential policy coordination. We have the state of Rondônia, who implemented the most stringent policies during the pandemic, and the governor of Rondônia is from the same party as Bolsonaro, meaning that we would have expected that governors who aligned with Bolsonaro would have implemented very low levels of stringency, but the case, as Rondônia shows us, that was not the case. No evidence of partisan policy coordination, only a few evidence in states that pertain to the Partido de los Trabajadores, the PT states, and we see that the PT governors also were able to slightly coordinate, but only for a very short period of time. So in terms of what we learned, so we have learned with our studies that that parties matter quite a bit. that in politics in particular, and how presidents and governors coordinate matters a lot to explain subnational and cross-national policy responses. Of course, this research only studies the state level, and we know that that variation is even more present when we study big cities or municipalities within countries. So future research should take a look at how COVID played out at the municipal level. We also think that, this is only part of the story. We are here focusing on how policies are implemented, but here we're not looking at individual behavior, whether people followed those policies that were implemented. And in another set of papers, we are, with this research team, we are looking precisely at the issue of individual behavior in these same 3 countries that I presented today. So I will end up there, and I'm very happy to answer any comments, questions, or doubts that you might have during the Q&A.
Thank you so much, Professor Giraudi. And so now I will just, lots of things to think about, so I will just open it up for questions right now. You can raise your hand, and if I see you, I'll give you the opportunity to talk, or you can also write them in the chat box. I have many, but I don't want to start, so. Yes, Professor Smith.
Can we ask questions? Or?
Yeah, you can, of course. I have one here. Professor Smith-Walter, go ahead.
I'll put my hand down now. There we go. Thanks so much for all the great presentations. I was especially interested in the last one. Can you talk a little bit about the level of professionalization in the public health bureaucracies and whether or not that might have an impact on the policy stringencies and maybe any interactions with the existing sort of politicalization of the virus itself? Just thinking about, looking at policy diffusion theory, right? How do these things pass across the borders? And, we might have associations of bureaucrats who have nothing better to do than talk about ways to save people's lives. They're crazy that way. So any comments on that would be great.
Thank you. Let me see if there are a few questions so that we can collect them for the sake of time, and then give some time to answer. Other questions? I'll insert one from myself to Professor Binagwaho. It is still quite, I don't think you answered, I think you implied the answer, but I would like you to elaborate on why Africa surprised us so much when we were expecting something completely different, and to what extent is a story of policy, or is it a story of some maybe demographic factors that made the pandemic just go differently in Africa? I see 2 more hands, so I'm gonna, Imogen.
Yes, as a comment for the second speaker, and I don't want to mispronounce your name, but my daughter, who's 28, was home for 10 months and then returned to Shanghai December 6th, where she works. And she found things like she had to quarantine strictly for 2 weeks, very strict quarantine, couldn't step out of the hotel room, but she was able to go to work, she's able to go to parties, she's able to go shopping, she's able to do all those kinds of things. And when there were 6 cases in Shanghai, a couple of months ago at Meatpacker's place, she let us know about that. But it's so kind of is one example that I've experienced personally of what you were saying about that the economic stuff is back and flourishing because they took care of it. But there is the issue, of course, authoritarianism and not that. But anyway, I just wanted to just mention that.
Thank you. Dustin.
Hi, like everyone else, thanks for doing this, and I'm really glad that I came. It's been a great discussion so far. My question is for Dr. O as well. So in attempts to reopen in Asia, have you noticed that there's differences between the various countries and how that's affected like a resurgence in case numbers? Because I know that, for example, Taiwan and to an extent China have been doing this as well without having a like significant new increase in cases. But when, say, Japan adopted a policy of promoting domestic tourism to reopen the economy, that significantly enhanced the national spread. So I'm just curious, like how you think these differences are like manifesting.
So let me see, maybe we can add one more question, then I'll give you any other questions. Well, let's go ahead and see. So I'll go in the same order perhaps that we presented. So Professor Binagwaho, if you want to start.
I have to admit, yes. So you asked me why the epidemic followed that path in Africa. That's your question. I just want to recall that before the first case happened in Africa, CDC Africa called all ministers of health of the continent in a meeting and told them, don't follow the Western world. They take it light, don't. If you have a case, lock down. If you have a case, stop flight and see what you can do to control it. So I believe that so far, the entrance in the continent has been controlled, like now in my country. If you arrive, you need to have a PCR test, negative less than 4 days, and do a test at arrival. Before the test result, you are quarantined. So I think we are going to have an endemic disease for a long time because we don't have access to the vaccine. However, if we continue to manage like that, we can mitigate the problem. Months after the issue in Europe, there was no control of people coming. I told you that I was in Belgium in the beginning of March, was supposed to go to the US, and when I saw little kids, 9 years, going on school trip in Italy, where it was a mess at that time, with the Minister of Health of that country knowingly not stopping that, I say I have to go home. So I believe we have evidence-based intervention, and some African countries, not all, don't believe that it's an uniform continent. We had also our deniers. Unfortunately, 2 deniers die of it. And I think there is no surprise. Now there is a relaxation and still cross-border management, but not in countries. In many countries, masks are no longer there. And if we have a variant that enter and a spike of the pandemic, people may die massively because we don't have even the back capacity to treat them. I don't know. So also in my country, what happened, the cultivation of science and the cultivation of truth. I think that what killed so many people in the US is not necessarily the pandemic, it's the lies said by politicians for selfish reason to the citizen, push them not to use masks and say it's a law, etc. And as Dr. Burke says, the first 200,000 deaths we can accept, all the rest is due to lie. So I believe this is a major fact. Truth, trust, and just do what you can. But implement evidence-based intervention. It's a disease, treat it as such, not as a political tool.
Thank you. Professor O?
Thank you for great comments, sharing the experience of your daughter in Shanghai, which shows like China's ability to really enforce draconian rules on the society. But people in, for example, China and Singapore, they actually agree with government's stringent policy. So a lot of them said, well, we suffer from previous infectious disease before. We know how scary it is. We want strong government to intervene, and it is okay to sacrifice some of our privacy. We would rather have the freedom from the virus. So, but it's an authoritarian region. There's a little room from, like bottom-up opposition. In case of South Korea, so South Korea has been discussed as an interesting case. It's because it never had a travel ban, never had a lockdown, but controlled the transmission curve pretty well in early stage. And I would argue that, South Korea really suffered from MERS, the Middle East Respiratory Syndrome, back in 2015 that nobody really expected, and had the large outbreak, lots of problems with regulatory institutions. So they really changed every single crisis management system to address the next infectious disease better. So I think that worked pretty well in the beginning, and I would argue that South Korea kind of presents liberal democratic countries with an alternative to the top-heavy approach that China employed. So both of them are effective, but South Korea is still a democratic country, and there is a lot of still sporadic transmission taking place, especially around church. So if you see lots of outbreaks, it's usually around the religious groups. And again, it's a democratic country, so there's this discussion that the freedom of gathering and religion should be respected. Justin, you also mentioned the case of Japan. So Japan is a case where the pandemic has been very much politicized, which is quite surprising because Japan is a strong state. It is the leading strong state in East Asia that is followed by Korea, Taiwan, and Singapore and other places. And Japan has one of the best first-class emergency task force team and hospital system. However, Japan doesn't have a CDC, which is very shocking. They're better at kind of dealing with natural disasters like volcano eruptions, tsunami, and earthquakes, but not much with infectious diseases. So what they have is the National Institute of Infectious Diseases, and they're under the Ministry of Health with very little autonomy, and their budget is less than 1% of American CDC. So they don't have capacity and resources to address the virus. And I think the Japanese leadership's wish to host the Olympics really interfered with kind of fighting the virus. So unfortunately, it has all the right tools and institutions to a certain extent, but it is a case where politicization of the virus can cost a lot of lives.
Thank you, Professor. And I know probably at this point some of our students will have to leave because they have classes coming. But Professor Girardi, go ahead.
Yes, well, thank you so much for the question on the role of the bureaucracy. I'm assuming state bureaucracies and the influence of diffusion. That's an excellent question. Actually, the question about diffusion was one of the questions from one of our reviewers. We are working on the revise and resubmit of this article, and we are precisely trying to tease out these mechanisms of diffusion. So we are working on that, and we find evidence of meetings between governors or joint reports or joint presentations in which there is evidence of some coordination and diffusion. In terms of the role of the bureaucracy, unfortunately, our paper does not cover that. We are only interested, or we only have data. That is the reality. We only have data for what governors implemented. And it's very hard to get data for bureaucracies in all 28 states in Brazil, all 32 states in Mexico, and all 50 states in the US. I mean, it would be, I think that is a book project, right? We know, however, that bureaucracies were very important, and we know that for the case of Brazil in particular. We know that the local, state level health ministers were very important to address the pandemic. Yet, I mean, the scope condition of, this is just a paper, and the scope condition of the paper is that we're only looking at governors.
Thank you so much. I wanna, even though officially the time of the talk has it's over, I wanna see if there are any other comments or questions on the people who wanna stay a little longer. If there is anything that
Can I say a comment?
Sure.
That's not tackled by my colleagues here.
Mhm.
I think that a lot of failure are due to politicization and lie. And this should be the major pillar of democracy, no democracy, strong state, etc. Leave it. In this case, when you have leaders people trust, say that it's not an issue, then you have this mess in the country. When you have a democratic country that take the fact to tell the truth, it's a pandemic, you need to do A, B, C, D to save yourself or to save your neighbor, your beloved, and not let double speeches going on, then you save life. So, and we have to have the courage as scientists to call a liar, a selfish person, a selfish person. And those who die because of that, victim.
Professor Giraldo, you mentioned that you wanted to ask a question yourself.
No, my question was very much in line with yours. I was curious about the exceptionality of Africa, which has showed, as Professor Binawan said, that there is another route to address the pandemic. And I think that with my very limited knowledge of Africa, that the learning experience of that continent is something that the West should be looking at, right? So the legacies, this has built over time. That continent has been exposed to so many epidemics, they were not pandemics, that there is a lot to be learned from the West. And I am very glad that she made that point, right? That it's also an issue of being humble and learn from Africa.
Augusta, I want also to tell you that Africa is not uniform. Our neighbors in Tanzania, the president himself who said that COVID is invented by the people, but they are protected because they believe in God. He did so also for political reason because there was an election and he needed that crowd to come. So we had that. We had that in Burundi as well, where the president went to die of an attack somewhere. We know it's COVID. But I just want to tell you that for me, that's the reason why lying to people has killed more than it's the liar who kills people. So there is no difference between the two parts of the world. The only thing we need to discuss now also is COVID has shown us that you may have the best 5-star health system. It's not enough. Solidarity in community, caring in community, putting masks to protect others are more important than to have thousands of respirators.
I have a question. Hi. This is for Dr. Sonia. I'm just wondering if you also took a look at Myanmar's case, because in Myanmar, COVID rate was very low to begin with, despite lack of state capacities and other factors that you mentioned. And then after the military coup on February 1st, 2021, we haven't heard anything about COVID. It's just disappeared. So, and I'm just wondering, is that because well, I try to ask people specifically about that. I talk to doctors and clinics and healthcare professions, and nobody. They said they haven't seen any cases on COVID. So that was something that is very strange to me. So I'm just wondering if you have any information about what's happening in terms of the spread of COVID after the coup in February.
Well, great question. I wish I have an answer to that. But I think the reason why foreigners or external sources don't have clear ideas about what is really happening there is because government is blocking internet and controlling the information very much. But even before the military coup, there is a lot of kind of suspicions that Myanmar is downplaying the number of cases and then the death. And that stands the same in the case of China as well. We don't really, there's a lot of challenge over the credibility of the death tolls and then the confirmed cases that initially came out of Wuhan. So that's in a way kind of fundamental limitations of not having a democratic context. Of course, democratic leaders also lie. That is another problem too, as has been discussed. But at this point, unfortunately, I think Myanmar people is fighting their lives, so they are probably not as scared as COVID, right? They're probably more scared of the government and then the generals and military. So it's unfortunate. But thank you for a great question. I'll look more into it.
Thank you.
Well, I think that I know one of our speakers has to leave, so I really want to thank our three really fantastic speakers, Dr. Binagwaho, Dr. O, Dr. Giraldi. Thank you so much on behalf of the department and the university for being here today. I think there is, if anything, I think there is an understanding that unless there is more coordination between countries too, we're probably not going to see the end of this very soon. Hopefully that changes. But thank you very much, and thank you to all the audience for being here. Have a great afternoon, everyone. Thank you.
Thank you so much.
Thank you.
Thank you. Bye-bye. It was great.
Thank you. Thank you very much. Okay, I think we can stop officially. Thank you, Aaron, for coming. I can't hear you, Judith. Nope. I lost you. No.
Thanks, Angelica. It was a lot of fun.
Thank you. Bye.
Bye.
Still can't hear you. Judith, can I ask you? I don't think I will be able to, but I had my class had joined my class had to be here, so I would like to see the attendance to just check the attendance of my students. Do you think? And I don't think I will have it in my Zoom because you created the meeting. So there's a way that you can get the attendance reports from Zoom. If you have to go to your main site, and then you can get a CSV file or like an Excel file with the attendance.